Nowadays, women lead very busy lives in comparison with the past. They work in a very demanding jobs as well as running a household with a husband and children. When older, they try to continue working, looking after their older children and grandchildren, running two families instead of one. Sabi ng author, I admire them for their hard work and the love they have for their families. But many of them come to me in frustration and anger that they cannot work as much as they could before their menopause. I do not believe a tablet or skin patch will, but put them right instantly, but balancing their energies in natural ways will help enormously and without side effects. Except in the case of women who are extremely malnourished and dehydrated, or those who have had an oophorectomy, the body will secrete the necessary hormones for our well-being. But when we take a pill to put it right, then we are inhibiting the body's coping mechanism. When a woman is of a certain age, it is a common regard all her problems as menopausal. If we take the trouble to question her more, we will find that many of these symptoms would have been bothering her for much longer. Excuse me. It is important for the patient and doctor to realize that menopause is not a medical condition, but a natural event, and that given the chance, the body will cope with it quite well. The main symptoms of menopause seems to be dryness and heat. The dryness is generalized, affecting the skin, head hair, nails, vagina, and the urethra. The heat seems to come in flashes and mainly to the upper part of the body, with sweating attacks. As the menopause begins with a decline in the female hormones, it is evident that the patient becomes yin deficient, which makes her more dry in the lower part of the body where the reproductive system lies. When the kidneys become yin deficient, they are in a yang dominant state, and the yang can rise higher from time to time. Heat, wherever it originates from, has a tendency to rise upward to the upper warmer, increasing the heat in the heart and lung, hence the hot flashes and the sweating. Night sweating is a special symptom of yin deficiency. It is normal to sweat when we feel hot, but we also need water in order to sweat. When the yin is deficient, there is less water for sweating. The yin would be filled in the yin situation during night and during sleep, when there is also water for sweat. This is why nocturnal sweating is a symptom of yin deficiency. So the treatment for postmenopausal syndrome is to tonify kidney yin, descend the ascending heat back to the lower warmer, and to treat the other problems symptomatically. It is also necessary to give dietary advice to patients. So we use kidney 4, which is the low point, tonifies yin and sedates yang. UB64, sedation, which is the U1 source point. This sedates the yang. This is optional and can be used if the heat symptoms are very strong. Spleen 6, descending technique. Ren 3, the move front of urinary bladder, tonifies yin. So we have here the needles to unblock scar, the kidney meridians, Ren meridians, and the location of the scar. If this woman have a lower abdominal scar due to cesarean section, hysterectomy, or other surgery in the past, it is important to unblock the meridians that had been blocked. The Ren and the kidney meridian should be unblocked using 2 needles. 1 on either side of the scar, 6 in all for 3 meridians, and 1 needle on point Ren 24 to bring the yin to the head. Symptomatic points for the poor sleep, we use Do 20, good night, amnian, extra point. night sweat, lung 7, low point, closes the skin pores, anxiety, tachycardia, PC 6, REM 14, heart 5. Advice against heat, avoid coffee, red meat, spicy food, take midday rest. Against dryness, drink plenty of water, eat watery fruits, and clear soups, swim or bath, and then sleep. Kidney governs water metabolism. At all times, the quantity of water in our body is equal to our kidney yin. Kidney yang affects the distribution and elimination of this water. Urination is an elimination of excess water and toxins from the body. The kidney function, Qi, is to decide correctly how much water should be stored in the body and how much should be eliminated. If there is excessive urination, it is not necessarily a sign of excellent function of the kidneys. Little concentrated urine is also not always a symptom of poor function of the kidneys. The correct function of the kidneys depend on the quantity of water in the body. For instance, if the weather turns cold and the kidney yin increases, if the function is good, the kidney will send out more water, more urine. If there is much water in the body and the kidney function is poor, there would be less urination and water retention. If the body is dry, the healthy kidney will try to hold on to the water and urine will be infrequent and concentrated. This may cause kidney stones and consequent kidney colic with rising yang and hematuria. And if the body is dry and there is increased thirst, the patient urinates excessively every time he or she has a drink. It indicates poor function of the kidney. So, sa kidney function, the first tower diagram, excess ang yin, normal ang qi, yin excess and normal function, frequent and excessive urination, no dryness or thirst. Next is excess ang yin, deficient ang qi. Yin excess, less urine output, poor function with water retention and edema. Next is deficient ang yin, normal ang kidney qi, general dryness with good function, little urine, 2 to 3 times a day, concentrated, can get kidney stones and colic. And the last tower diagram, both are deficient, general dryness, excessive thirst, and frequent excessive urination cannot retain water. The symptoms of the urinary bladder are problems with holding and releasing urine. The yin of the bladder is its capacity and the quantity of urine it holds. The function is to decide when to open and when to close. For instance, opening the urethral sphincter before the person gets to a toilet and not to be able to open it after getting to the toilet, what shows poor function or qi deficiency. To pass urine with a poor stream with some amount left in the bladder after urination and dribbling after urination is completed after qi deficiency symptoms as well. Urgency, increased frequency when nervous, and burning urination are symptoms of excessive yang or heat. Cystitis, prostatitis are symptoms of yang excess. Okay, we go to acute cystitis sa urinary bladder. The first tower diagram, yin and yang are both excess. Then there is excess in blood and excess in yang and deficient in qi. In the acute phase, there is a heat and inflammation with stagnation of thick fluid. When subacute, this harmful yang affects the functional qi of the urinary bladder. The treatment should eliminate and cool the heat while assisting the functional qi. So we use the points, REN 3, the move point, cools and calms the organ. Spleen 6, the area distal point for lower abdomen. UB63, sedation. The C-clef point sedates excess during an acute situation. UB28, the bleeding cup, eliminates heat from internal organ. Sa ear, we use the urinary bladder, urethra, adrenal gland for inflammation, and Shenmen for pain and tranquilization. Drink water, keep feet and lower part of the body warm, and rest. In the acute phase, 1 to 2 sessions of treatment per day. Symptoms should improve within 1 to 2 days, or antibiotics should be given.